A heart attack occurs when there's sudden, complete blockage of a coronary artery that supplies blood to an area of the heart. This causes the area on the heart where the blood is supplying to die. Unless there is a quick and early medical intervention, this could result in permanent damage. To understand a heart attack, you need to know how the heart works. The heart is a muscular pump and it needs a continuous supply of oxygen. The oxygen comes from its rich blood supply, and the heart is supplied with this blood through arteries on the heart surface called coronary arteries. The most common cause of a heart attack is coronary artery disease. This is the slow buildup of fatty deposits on the inner wall of the arteries which supply the heart muscle with blood. We call these fatty deposits plaques, and with progression of coronary artery disease, the coronary arteries get clogged up from the inside, causing the arteries to get narrow. This process usually happens over a long period of time. So imagine if this thick plaque breaks or chips, what could happen is blood cells could start sticking to the area and cause a clot, which may totally block the artery, and it would block the blood flow to the heart muscle. The parts of the heart it supplies would no longer get blood flow or oxygen, so it would start to get damaged. There are some signs and symptoms of a heart attack. Sometimes there's severe symptoms, but other times there could be minimal symptoms, but they progress more and more. In certain cases, there may be no symptoms at all. Chest pain is the first one, so the pain can come on slowly or it could be sudden. It's usually at the center of the chest and lasts for a few minutes. Or it could go away and come back. It can feel like tightness, pressure, and squeezing. A lot of people describe it as a band wrapped around the chest and it's getting tighter, or like a crushing sensation on the chest. The pain can range from being severe, moderate, or mild. More symptoms include pain spreading or radiating to the neck, jaw, shoulders, and arms. Some may feel the pain elsewhere on the upper body and not on the chest, like it could be in the throat or just the arms. There are also other symptoms like difficulty breathing, nausea, cold sweats, dizziness, and shortness of breath. You may have heard of a medical condition called angina. This is where you can get pain in the chest due to coronary artery disease, but it often occurs when exercising or being active. This type of pain usually only lasts for a few minutes and it goes away with rest. Angina pain, which doesn't go away or occurs more frequently, or even when at rest, can be a sign that a heart attack is starting, so it's best to get checked by a doctor immediately. So in terms of how a heart attack is managed, an ambulance should be called to take you immediately to the hospital. While waiting for an ambulance, it may be helpful to chew and then swallow a tablet of aspirin, ideally 300 milligrams, as long as though you're not allergic to aspirin. Aspirin helps to thin the blood and improves blood flow to the heart. In the hospital, the treatment for a heart attack depends on how serious it is. The two main treatments are using medicines to dissolve the blood clot or surgery to help restore blood to the heart. Some medications used to dissolve blood clots include heparin and warfarin, and it's often delivered through a vein. Angioplasty and stent implantation is a treatment for a heart attack which aims to restore blood flow to the heart by using a special balloon which opens the blocked artery from the inside, and usually a stent is placed to keep it open. Bypass surgery could be another option where blood flow is redirected around the narrowed area, which helps increase blood flow more freely to the heart. Following a heart attack, some people develop abnormal heart rhythms, known as arrhythmia. Some cases, a small device can be implanted into the chest and connected to the heart to treat arrhythmia, and this is known as an implantable cardiac defibrillator. In terms of heart attack recovery, the time it takes to recover from a heart attack will depend on how much damage there is to the heart muscle. Most people can return to work after having a heart attack. Some people are well enough to return to work after 2 weeks. Other people may take several months to recover. How quickly you can go back to work depends on your health, the state of your heart, and the type of work that you do. The recovery process aims to reduce your risk of another heart attack through a combination of lifestyle changes, such as eating a healthy diet, medication like statins which help to lower your blood cholesterol, and potentially surgery which may improve the blood flow to the heart. It's also important to gradually restore your physical fitness so you can resume normal activities. So we've made it to the end of the video. Leave a 100 emoji and like this video so I know you've made it to the end. If you have any questions, feel free to comment and I'll do my best to get back to you.